Good morning. Myself is Ranveer Kaur and my student ID is 133357244 and this is the 360 of my room. Good morning.
Good morning.
Myself is Ranveer Kaur and I'm your nurse today and doctor ordered for your head to toe assessment to know about your general health. What's your name?
My name is Seneca Kaur.
And your date of birth?
7 March 2003.
Okay, could you show me your ID band? Yeah, it matches with my documentation. Now I'll give you a privacy. Hand washing. Firstly, starting from the neurological assessment, the level of consciousness. And where are you right now?
In a Seneca college.
And it's evening or morning?
It's morning.
Okay, who is the Prime Minister of USA?
Donald Trump.
Okay, my patient is alert and oriented times 3, person, place and time according to my question. Now I'm gonna check the Perla. The consensual and non-consensual reflexes are intact whenever I put light on my patient's eye. Could you please see on the tip of my finger? The accommodation is intact to far away and near vision of my patient. Now I'm gonna move to the next part. Slurred facial droop. Could you please smile for me? Raise your eyebrow. There is no facial droop observed unilaterally. Now, could you please repeat the sentence that I said to you? Sky is blue.
Sky is blue.
I'm beautiful.
I'm beautiful.
Thank you. There is no slurred speech noted. Could you please stand up for me? Straight your hand like that. Close your eyes. Count for 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Thank you. Sit down. The pronator drift is negative bilaterally. Now moving forward to the respiration assessment. Could you please breathe in and out for me? Thank you. Turn around. Breathe in and out. In and out. Thank you. Move towards me. The expansion and retraction of the chest wall is equal bilaterally and breathing is unlabored. Now I'm going to inspect the points on the front and the back. 10 points on the front and 18 points on the back. Starting from the right side above to the clavicular, the first, second, third, fourth, fifth, and the fifth. Will you please turn around? I'm auscultate the point between the scapula. Starting from here. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 9. Thank you. Please turn around. The lung sounds are clear and there is no adventitious breath sound noted bilaterally. No stridor, no crackles, no wheezing. And moving to the cardiac assessment. Firstly, the landmark. Starting from the right side to the clavicular. First intercostal space. The second intercostal space to the right sternal border is our aortic wall. Moving to the left side, left sternal border to the left intercostal space our pulmonic wall. Third intercostal space to the left sternal border is Erb's point. Fourth intercostal space to the left sternal border is our tricuspid wall. Fifth intercostal space to the mid-clavicular is our mitral wall and the apical pulse. Now I'm going to check the apical pulse for 30 seconds. The rate is 72 beats per minute. The rhythm is regular and the strength is +2, and there is no murmur observed during my auscultation. Now moving to the abdominal assessment. Could you please lay down for me? Firstly, I inspect the abdomen. Abdomen is flat, there is no lumps, bumps and lesion present. Now I'm gonna check the counter from the side view. From the foot side view, the abdomen is flat and symmetric bilaterally. Now I'm gonna check the auscultate the abdomen. Do you have any pain on your abdomen?
No.
Starting from the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Vowel sounds are active on in 4 quadrants. Now I'm gonna move to the palpation of the abdomen in the same symmetry. Starting from the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. During my palpation, light palpation, there is no lumps, bumps and lesion and mass is present. Now moving to the integumentary system and extremity. Could you please sit down? Firstly, I'm gonna inspect both hands and arms. Do you feel any pain?
No.
Thank you. And there is no pain on both hands and arms. There is no edema, no deformity, any bruises present. Could you give me your both legs? Do you feel any pain?
No.
Okay. There is no pain, no edema, no deformity present on both legs and toes. Now I'm gonna check the skin turgor. The skin is intact, no tenting is noted on both hands. Now I'm gonna check the skin turgor on both toes. The skin is intact and no tenting is noted. Moving to the elbow for the pressure ulcer. I'm gonna assess there is no pressure ulcer, no bruises on this side, and there is no bruises, no pressure ulcer on the other side. Now moving to the nails. Nails are pink in color, no broken, no clubbing, no cyanosis present. Now the capillary refill. The blood is returned in less than 2 seconds on both hands. Now moving to the toes. The blood is returned dark in less than 2 seconds on both toes. Now moving to the muscle strength on the hands. Could you push me? Pull me. Thank you. On both toes. Push me. Thank you. The muscle strength on both hands and legs is 5+, which is normal. Now moving to the pulses from the carotid plus, which is below the jaw between the trachea and sternomastoid muscle. On the other side, between the trachea and sternomastoid muscle. Could you please lay down? Bend your knees. The dorsal pedis is top of the foot. Posterior tibial inner side of the foot. Okay. The pulse is 72 beats per minute and strength is +2 and pulse is regular. And thank you so much. Do you have any question? Could you sit down? Okay, thank you. Thank you. And this is the 360 of my room. Thank you.